You know that feeling? You're home after a long walk, rubbing your dog's head, and your fingers just, they catch on something.
Little bump that wasn't there yesterday.
Exactly. And your heart just drops. You part the fur and, yep, there it is, a tick. So you go into action mode, you get the tweezers, you pull it off. But after it's gone, the quiet sets in and the anxiety starts.
Because getting the tick off is just the start. The real question, the one that keeps you up, is what did it leave behind?
That's exactly what we're digging into today. And we're not just doing a broad ticks are bad segment. We're going deep on one specific and, frankly, terrifying outcome of that bite. We're talking about babesiosis.
Right.
We've got a pile of veterinary research and clinical guides here, and our mission is to turn that panic you feel into a proactive plan, to understand exactly how this thing works.
And that's the key.
Yeah.
Because this parasite, it's a formidable enemy, for sure, but it follows a set of rules. It has a timeline. And if you know that timeline, you have a huge advantage.
Okay, so let's start right there. The enemy itself.
What is babesiosis? It's not a bacteria. It's not a virus.
No, it's a protozoan, a tiny single-celled parasite. And it can't fly or jump, so it needs a taxi.
The tick.
The tick. Specifically, the literature points a very, very strong finger at one genus in particular, Rhipicephalus sanguineus.
Which is the brown dog tick. Now, I think a lot of us have this idea that ticks are a deep in the woods kind of problem.
That's a really dangerous assumption.
Right, because this one is different.
Very different. This tick is what we call endophilic. It actually loves being indoors. It can complete its entire life cycle in your house. In kennels, in baseboards, it doesn't need a forest.
Wow. So the I live in the city, my dog is safe argument just doesn't work.
It absolutely does not. The risk is where dogs gather.
Okay, so the tick gets on, it bites, but the transfer of this Babesia parasite, it isn't immediate, right? It's not like a mosquito injecting malaria instantly.
No, and honestly, this is the single most important piece of information for every dog owner.
Right.
There's a delay, a grace period. A grace period, I like that.
When the tick first bites, the parasites are basically dormant inside its gut. They need a trigger to wake up.
And that trigger is the dog's blood.
Exactly. The warm blood meal starts a process, the parasites activate, and then they have to travel from the tick's gut all the way to its salivary glands. And that journey, it takes time.
And that is our window. How much time are we talking about? The research suggests, what, 24 to 48 hours?
That's the general consensus, yes. Transmission is pretty unlikely in the first 24 hours. The risk really ramps up as you approach that 48-hour mark.
So if you're doing a daily check on your dog, I mean a really thorough one,
you're very likely finding and removing that tick before it's even had a chance to transmit the parasite. You're severing the bridge before the army can cross.
that is actually really good news. It puts some power back in our hands.
It does.
But let's follow the worst case scenario. The tick is missed, the 48 hours pass, the parasite gets injected into the bloodstream. What's its mission?
It has a very specific target. It's what we call an intraerythrocytic parasite.
Meaning inside red blood cells.
Exactly. It breaks into the red blood cells, the very cells that carry oxygen through the body, and it uses them as a nursery.
A nursery that destroys the room.
The nursery that eventually explodes, yes. The parasites multiply until the cell bursts. But here's the really devastating part. It's not just the parasite doing the damage.
What do you mean?
The dog's own immune system sees these infected red blood cells and marks them for destruction. It's a massive case of friendly fire. The spleen just starts clearing out red blood cells, even ones that aren't infected yet.
So it's a two-front war against the dog's own oxygen supply.
A catastrophic crash in the red blood cell count.
Yeah.
Medically, we call it severe anemia. But practically, it means the dog's body is starving for oxygen.
And that explains the first symptoms, the ones that are so easy to miss.
It all comes back to that lack of oxygen. The first sign is almost always lethargy. And I don't just mean a tired dog. It's a profound apathy. A dog that usually loves walks suddenly doesn't want to get off the couch.
Right, that kind of listlessness.
And it's often paired with a loss of appetite. You know, your food-crazy lab who suddenly won't even look at their dinner. That's a huge warning sign.
Okay, so lethargy and not eating, that's worrying, but it could be a lot of things. How do we spot the signs of that red blood cell destruction specifically?
You have to look at the mucous membranes.
The gums.
The gums inside the eyelids. In a healthy dog, they're a nice bright pink. With this kind of anemia, they become pale, sometimes chalky white.
That's the lack of blood showing through.
Precisely. And then, as the cells are destroyed, they release a waste product called bilirubin. The liver gets overwhelmed, and the dog becomes jaundiced.
So a yellowing of the skin,
Yes, the whites of the eyes, the inside of the ear flaps, you'll see a yellow tint.
pale
Yeah.
gums, yellow eyes. But the sources all mentioned one symptom that seems to be the real smoking gun, the the dark urine.
Hemoglobinuria, yes. This is the hallmark of a severe, life-threatening infection. They often describe it as looking like Coca-Cola.
Why does that happen? It's not just blood in the urine, is it?
No, it's different and much more serious. When the red blood cells burst in the bloodstream, they release all their hemoglobin, the red pigment. The kidneys desperately try to filter all this free-floating pigment out of the blood, and it just overwhelms them.
And it stains the urine that dark reddish-brown color.
It does, and if you ever see that color urine from your dog, you don't wait. You don't call in the morning. That is an emergency.
Drop everything and go.
Drop everything. It means the system is in crisis.
So it's a spectrum, from the dog just being a bit off to the fever and pale gums, and then to the really critical signs like jaundice and dark urine.
And the outcome is almost entirely dependent on where in that spectrum you intervene. Catch it early, the prognosis is great. Wait until the dog has collapsed. It's a much harder fight.
It just shows that wait and see is not a strategy here.
With babesiosis, time is tissue. Every hour you wait, more cells are being destroyed.
Okay, this is heavy, but let's shift to what we can control. Prevention. The sources repeat it like a mantra. Prevention, prevention, prevention.
It's everything. And it's not just one single thing. It's about building layers of defense.
The Swiss cheese model.
Exactly. Every layer has holes, but if you stack them, it's hard for anything to get through.
Layer 1 is the physical check. We talked about that 48-hour window, but where should people be looking? Ticks are masters of hiding.
You have to think like a tick. They want places that are warm, safe, and have thin skin. So check deep in the ears. Under the collar is a classic spot.
The armpits and in groin area.
Absolutely. The axillae. But the one so many people miss is between the toes.
Oh, really?
They love it there. It's protected, it's warm. Run your fingers through every single toe gap every single day.
That's a great tip. Okay, layer 2, antiparasitics. This gets confusing. You've got spot-ons, collars, pills.
Right. And they work in different ways.
Yeah.
Some of the topicals, like certain collars or pipettes, have a repellent effect. They try to keep the tick from biting at all.
Which sounds perfect.
In theory.
Yeah.
But they can wash off, or the coverage might not be total. Then you have the oral options, the chewable tablets.
And those don't repel. The tick has to bite, right? Which sounds scary.
It sounds counterintuitive, but remember the window. Those pills work very fast. The tick bites, ingests the medication from the blood, and dies, usually within just a few hours.
Well, within that 24-hour safety margin.
Exactly. The tick dies long before it can transmit the parasite. And the advantage is that it can't be washed off. For dogs that swim or get bathed a lot, it's a really reliable option.
The sources also mentioned injectable solutions, calling them one of the safest and most efficient methods.
Yes, this is a fantastic tool in the toolbox. They're long-acting preventatives given by a vet.
And it eliminates the human error factor. You can't forget to give a pill.
Correct. Compliance is the #1 reason prevention fails.
Yeah.
An injection covers the dog for a set period, sometimes for many months, and you know it's working.
Okay, so checks and chemical preventatives. What about the vaccine? This seems to be the most misunderstood layer.
It is. When people hear vaccine, they think 100% immunity, like a measles shot.
Right, you get it and you can't get the disease.
The babesiosis vaccine doesn't provide that. It's not what we call a sterilizing immunity. A vaccinated dog can still get infected.
So, what's the point then?
The point is to dramatically reduce the severity of the disease. It primes the immune system so that if an infection does occur, it can fight it off much more effectively.
It's the difference between the dog feeling sick for a few days versus ending up in the ICU with kidney failure.
Precisely. It turns a potential fatality into a manageable illness. It's a seatbelt. It doesn't stop the crash, but it can save your life.
Great analogy. So it's not a replacement for tick killer.
Not at all. It's an additional layer of protection, especially for high-risk dogs. But you must continue the regular antiparasitic treatments.
It's an and, not an or.
Always.
So as we wrap up, I want to circle back to something you said earlier about the risk not being seasonal anymore.
The old rules are out the window.
Because with milder winters, and with this particular tick's ability to live indoors,
the tick season is becoming a year-round event. We see active ticks whenever the temperature is above freezing. The parasites don't check the calendar. They're just looking for a meal.
It really shifts the mindset from a summer problem to a constant state of vigilance.
It has to.
Yeah.
Year-round prevention is the new standard of care.
Okay, let's distill this all down. 3 golden rules for our listeners. What's number 1?
Respect the 24-hour clock. That's your grace period. Check your dog from nose to tail every single day and remove any ticks you find immediately.
Number 2?
Know the red flags. Lethargy and not eating are the first whispers. Pale gums are a shout, and dark, reddish-brown urine is a siren. Do not ignore it.
And the 3rd?
Use a vet-approved anti-parasitic all year round. Whether it's a collar, a pill, or an injection, have that chemical shield up and running at all times. Don't rely on just checking.
Simple, clear, and life-saving. It's all about routine and observation.
It is. You know your dog. Trust your instincts. If something feels off, it probably is.
And that leaves us with a final thought. We've talked about year-round prevention, but with our climate changing, maybe the real question we should be asking ourselves is tick season a thing of the past? And is our vigilance keeping up with that new reality?
A question every pet owner needs to consider. Stay safe out there.